The sun rises gently over the shimmering waters of Lake Victoria, painting the horizon in gold. To a visitor, the calm beauty of the lake seems almost magical. But for expectant mothers living on Sowe Paradise Island, this quiet morning glow hides a daily battle for survival. Here, giving birth is not just a natural process, it's a dangerous gamble.
Okuzaala ibisa bubinyonyo tulina lyato tulina yini kuba omuntu olumwa bamwe abatalina busobozi walumwa ate kupapalamba ate genda wagundi kumwazi kayingini ate kumwazi kayingini kusasula amafuta kusasula eryato lipangisa yingini ogipangisa akuvuga n'omupangisa. Sowe Paradise, tucked within Mpata parish in Kalangalo Subcounty, Mukono South Constituency, is a home to over 500 men, women and children. The community thrives on fishing, the lake their lifeblood.
Wow, kale season bintu biba mu season civil season nti biberamu kitegedde season wetuukanga gyebirera tubetta.
Yet beyond fishing nets and wooden boats lies another reality. A life marked by limited services, harsh living conditions, and a health system that remains painfully out of reach. When labor pains begin, mothers must embark on a perilous 30 to 45-minute journey across the lake to reach the nearest health facility. At night, in stormy waters or with no boat available, the journey becomes almost impossible.
Okuzaala bazaala naye era kuno tulinako azaazisa naye eddagala takwata mu ddagala nti mulokole. Kasita akuzaaza n'olema abo bani abalina kukusindikawo amalwaliro ga gavumenti ate era eryato oba olina pangisa lipangisa.
Temu abatalina busobozi obutenzi baluma oba omwana n'alemerayo oba ekintu kyemayiga nekiremerayo kati ogenda okupapala simanyi kunoonya dda simanyi kukakana ng'omuntu akufiiriddeko oba olusa abaana nga bafudde bakikola nnyo mu mazzi.
During our visit, the village leadership welcomed us warmly. LC1 chairperson Mr. Chimera Ben and area councillor Katerega Samuel led us into the chairman's humble office, a small structure that stands as the administrative heartbeat of the island. But even they admitted that the island's needs far outweigh its capacity to respond. In case one of us falls sick, we have to cross the lake. We have to cross the water. In case one of us falls sick, we have to seek a medical help from Kampala, Gaba. That's so far the nearest place. Clinics which are available are private and unregulated. Sometimes some mothers give birth in their houses. Women gathered to share their stories. We don't have any health workers on this island. Immediately you get pregnant, there is nothing you get. Our challenges are many. If you don't have money to give birth here. Sometimes the baby comes before we reach. One mother whispered, tears in her eyes. Sometimes we don't make it at all. My experience was worse, but thank God I was accompanied by a fellow woman who helped me give birth successfully. For example, I am diagnosed with pressure, but for me to acquire health care, I need to cross the lake, which is quite expensive for us. Their stories were echoed by the men on the island, husbands and fathers who have watched their wives bleed, struggle, or suffer simply because healthcare is a boat ride too far.
Amanya nzere Gambaraka sansenyo balaba bana mawuliro kutoka ku kizinga kyaffe kino amazima omulango enkuba bw'amaanyi nafuna okusoomooza kw'amaanyi nnyo nga mukazi wange alumizibwa atuuse essaawa ekolaki ey'okuzaala banaye nabonaabona okufuna omuzaakisa okumpa eryato okugula amafuta tebiseera omanya essente naye sinaawo bulungi era okusoomooza kunasiŋŋaana nalwa nnyo accident yagwawo kunkwata mu mazzi omukazi n'asumukira mu budde obwo mu mazzi.
In this struggle, the community relies heavily on one man, Samuel, their lone village health team VHT member, overwhelmed yet committed. He spoke passionately about the challenges he faces.
As me, I work as VHT of this place, but sometimes we get a problem of transport because other people, they come to me in night time saying that they are bad off, they want to go to produce, no means. So I get that confusion and I feel that problem. One day, a certain lady came to me. It was at night. She told me that I should escort her to the hospital. I tried to escort her, reaching in the water. She started producing, and that lady, she produced two twins. So
we have no bathing kits, no mosquito nets, no emergency transport. Samuel said, I am one person and the problems are too many.
Takes a long to reach on us.
The community lacks not only healthcare services, but also adequate education and protection for young girls. Even education is a challenge. When children grow up to around 6 to 7 years, we are prompted to take them across the lake. Life is too hard. My daughter has 3 children, but she left those children with me. I struggle for them, and everything is expensive as per now. When asked about political leaders, residents expressed frustration and abandonment. They feel unheard and unseen. We call upon our area MP, Kayondo Fred, call upon him to raise a voice for us. Immediately he watched this news, remember the people of Sowe Island. Call upon the president to come for our rescue. We see in other islands the president goes on to give our fellow border borders, but on our island we have never seen any. Call upon President Museveni to come rescue us, women of this island. In pursuit of answers, we reached out to Honorable Fred Kayondo, the area member of parliament for Mukono South Constituency.
But what has been your intervention in regards to service delivery regarding your people in that area? Yes.
I understand, the health system and the health policies within the country. But at least each and every sub-county there must be a health center theory. And that is an island, the health center theory is in Mpata. That is the health center theory which is there. Generally, across the whole country, not only in Mukono South, we have inadequate drugs, not only in Mukono South. I think across the country, it is the same way we are having all over. So we are advocating to see that at least adequate drugs are supplied at the centers, and that is, that is a government policy from the Ministry of Health. That's the government policy. And I understand when it comes to transport, you can see that at least there are some private transport vessels, and we are advocating at least for the government to come up and provide the transport for those people, like public transport means that in case people are sick, at least they can have what to use to access the health care.
The Minister of Health, responsible for service delivery across Uganda, acknowledges that hard-to-reach areas like Sowe Island face severe challenges.
I've not been to the island myself, but as a Ministry of Health first, our strategy mainly now is ensuring health prevention and disease prevention. And that's why we have a level of health workers known as community health extension workers and also village health teams. So places like that, Paradise Island, you said it's called Sowe Paradise Island, we rely on ensuring that we have our primary health care health workers who are the village health teams who are supposed to tell people on what to do whenever they are sick. Of a physical hospital structure does not mean absence of the Ministry of Health in a certain place. And also these facilities are allocated to basing on the numbers of the population. A health center 3 is the beginning level of care, and it is about 20,000 people. That island has not reached that number.
Aineliona Emmanuel, the ministry spokesperson, pointed to programs meant to support remote communities, including the provision of boat ambulances.
Health workers on the ground.
There is only one.
Yes.
Only one person who is overwhelmed by
Yes, so that's what I'm saying. We are going to look at how we can strengthen and train more village health teams and also community health extension workers for disadvantaged locations like the Sowe Paradise Island.
In search for further answers, we reached out to the Minister of Works and Transport, General Katumba Wamala. Shockingly, he admitted he had never heard of Sowe Paradise Island, but pledged to visit and explore possible solutions.
Kalangalo Subcounty.
You take it, talk off from where? From Katosi? From where?
No. Me, when I went there, I used the Busavala. I used the Busavala landing site, okukwata eryato okugendayo.
Not again, the Yegundi Mpata.
Mpata, exactly. Side eyo.
Amala okunanga okunoonyereza ogaye bakiyita
Sowe Paradise.
Sowe Paradise.
Yes.
Sowe Paradise Island is a community full of life, resilience and hope, but its mothers remain trapped between beauty and danger, between giving life and risking death. Their plea is simple: a healthy facility closer to home, a boat ambulance that actually exists, mosquito nets, trained personnel, a chance to give birth safely. Nagujja Serena for NSTV.